Hello, my name is Damaris.
Hello, my name is Ida.
My name is Ryan.
And welcome to today's episode of Sedaye Daneshjoo. Today we want to kind of dive into talking about the stigma surrounding mental health, particularly now as the conversation surrounding mental health is beginning to change in a really positive way. So yeah, I mean, we could just dive right in.
Yeah, we were talking before the show about like clinical experiences we had just around people that have mental health issues. I can't say that it personally, I suppose it did kind of affect me in the sense that I learned to be more empathetic towards them. Of course, how to sort of have the soft skills of how to talk to people with mental health problems. I realized it's kind of embarrassing. I realized that it was kind of a no-no to converse with them regarding their delusions, schizophrenic people, as if their delusions were real. Like any amount of feeding that is like directly feeding that. Like you can still like I don't know. This is just a conversation that someone pulled me aside. Like just proper etiquette around because I didn't receive that type of training before. You
I
know.
think, yeah, I think it's also important to try and meet people where they are. So maybe not necessarily feeding into the delusions, but understanding what they're experiencing. Because that's also the case with people who have Alzheimer's or dementia. They might think that something is going on. Like they might ask, even if they're very old, for example, if they're elderly and their parents have long gone, they might ask, where's my mom or where's my dad? And it's really traumatic to relive the situation for them of saying like, oh, they have passed, they're not here anymore. So it might just be better to tell them, for example, oh, they're at the store. Because
Yeah.
later on they might just ask again, and so you can say, they're still at the store. So I think that's another important thing also.
Yeah,
So
definitely. I agree with that. I think there's like knowing not to feed into the delusion, trying to say things that don't escalate the delusion, but also not completely ignoring it and not like making them feel like different and they can't tell you what they're experiencing or what they're thinking. So I think it's just like finding that balance of trying to like calm the situation while making them feel heard also.
Speaking of balance, there's a balance in like so I worked in EMS. There's a balance between allowing the patient control because of their psychosis. So sometimes when the patients are like that, they're actually delusional and they have psychosis, schizophrenia. They garner a certain level of control over providers. I saw a TikTok about this the other day, and it reminded me of some of the ways that providers would step around patients, especially more when they leaned into that. Like it's like it it puts a damper on proper conduct, but and also speedy patient care. Just for example, like we were in the emergency and a patient was threatening violence. Um, I ended up going in there. I don't know. I guess I thought it was kind of fishy, like what was going on. I had a little more experience or was primed because I guess maybe I'd been dealing with some other mental health patients that day. But I asked the patient like, what's wrong? You know, sometimes confronting the psychosis and also forcing the patient to confront themselves in like a real way, just like almost like well the our generation we might say like let's keep it real or something, but let's keep it real, which can be damaging sometimes to say, but in certain contexts you might just ask a patient to reflect on what they're doing, what they're thinking. Reflection is a really powerful tool in the provider's tool belt to kind of like you're saying like get to their level. It made me think about that.
Yeah, I think reflection for the patient side is really important pretty much in any sense. Especially regarding mental illness, but even when it's not so serious, I would say. So even if somebody is not, um, I don't know, schizophrenic with really bad hallucinations and delusions, even if they are somebody who is experiencing anxiety or depression, that's kind of like part of the goal of cognitive behavioral therapy is to get somebody to the point where they can have that metacognition of thinking about their negative thoughts and just reflecting in that way to then change their thinking in the future.
Right. Yeah. I mean, I'm not like an expert or anything, but I remember learning in my behavioral psychology classes, like a lot of behaviors are habits over time, and like certain types of thoughts, certain types of like things that, are like, for example, like I pick my skin around my nails or something like that. And that's like a behavior that's like over time, it's a habit. So I think thoughts are also habits too, in a sort of sense, where it could be a pattern during certain situations when you're under stress and you have those thoughts. And I think working through them and understanding like the triggers and what causes those is like really important for someone's future. I'm not an expert and I still have work to do on myself, but it's just interesting, I think.
I think it's really important that you bring that up though, because mental health is something that we all have, whether it's good or bad. And so I think that is part of breaking the stigma, is just talking about how we all go through these things, whether it be like something really heavy or something a bit lighter that we all kind of carry.
I think the bar for what's heavy will, I think for the better, go up. At least like if you consider like severity of mental health on a spectrum, I think that the bar for like what is normal, so the low end, should go up, right? This is a part of demedicalizing depression. It's not all like major depressive, and it's not all like suicide ideation. If you just like lost a family member and maybe they died in a horrible accident and you saw it, you were like right there, really awful stuff happening to people, and you in an interview you're telling your doctor, oh man, I just feel like ending it, man. Oh, so you have SI, like, and that goes on your chart. I think it's a really powerful movement that our generation of would-be providers are bringing about a more positive outlook on mental health. And it's not going to be so difficult in 10 years to tell your colleagues that are all Gen Zers and Gen Alpha doctors, yeah, like I have panic attacks. I'm not calling it panic disorder. I'm not trying to medicalize myself and self-diagnose. I just know that I've experienced symptoms of what is that disorder. I just think the language around it and the way that we perceive that is not helpful. You know what I mean? It's not helpful the way it is. So this maybe just thoughts for the future.
Yeah, I mean, I would say that things like depression and anxiety are serious, but at the same time, it is very common. Depression is known as the common cold of mental health or mental illness because people experience it all the time. So I think you have a point in saying that we should kind of step away from medicalizing it. I think it's important to talk about our problems rather than first like trying to seek out medication, or especially for providers to get that person to go to therapy or something of the like, instead of just trying to give them medication first.
Yeah. A lot of those, like the overdiagnosis of depression, especially like in emergency settings and internist setting, instead of consult psych, we need like a consult therapy or a consult like social work. You know what I mean? That's what I mean by the demedicalizing. I think right now we're kind of overshooting where we should be and diagnosing more common mental health problems, and we should kind of try to level that out a little bit.
That's interesting because I feel like sometimes like diagnoses have like they do feel heavy because once like you're labeled with something, it could feel like, oh, well, am I like this forever? Is this like forever like on my record or something like that? But I also think diagnosis helps sometimes bring clarity. It depends on how you like take it and what your mindset about it is. And sometimes like it's difficult because if you're already in like a place where you're at your low and you're not feeling good, then it might be hard to perceive it like as a good thing. Sometimes like it'll help bring information on, oh, so this is what's going on with me. Like for example, I'll share my experiences. I was having panic attacks when I was younger. I would say it was like my freshman year of college, and I thought that I had like a thyroid issue because there was like I would feel it around here. Not to like I don't want to trigger anyone or anything, but I would feel certain symptoms and I genuinely thought, oh, like, there's probably something wrong with my thyroid. Maybe I'll just go get a checkup. And then my primary care doctor was like, well, this sounds like you're having panic attacks. And I was like, oh, this is what a panic attack is. So it just, for me, that diagnosis helped bring clarity on what I was experiencing. And I think depends, like, knowing to reach out for support in times like that with like your doctor, your family, your friends, and just opening up conversations. It's helpful for someone who, doesn't know how to navigate that, doesn't know what to do and who to reach out for. I think just relying on close ones, knowing like, okay, well, this is what I have and I might feel more inclined to push them away, but like 5 years from now when I look back, like how would I want to help myself and to sort of give myself the support I need?
That's really smart. I think the context, like you're saying, the context that you're in, if you do have that family support, it makes it all the more easier to potentially recover and self-medicate or self-regulate. And then, depending on whatever like cultural and personal and your own personal ability to recognize that in yourself, but that, like it's beyond me. I also have, I've had what I would call panic attacks. And it's hard to talk about, but it's not something that and this is, we're getting real. It's all something that like, I haven't felt the need or the comfortability to seek care for because I think I can handle it, For a lot of people, it can be damaging, right? But it might honestly be better because I truly do get the sense that me going about anxious feelings and depressive feelings and panic-like symptoms and just trying to self-regulate and not share that in a clinical setting. I don't want it to be medicalized for myself. It's almost like a preference thing. Because, like you're saying, I don't want to be labeled with that, but it's not about the label. It's about the process. And in that sense, I think mental health services are lacking. Like, seeing people or patients go through that, I would not wish that upon myself if I were in their position. I think they deserve better, or a lot of mental health patients deserve better.
Yeah, and I think a lot of those changes that need to happen are often like institutional wide.
Yeah.
Unfortunately, I think that's the sad thing. California does do a lot. I think for mental health services, they do have a lot of different programs. I'm not sure on the specifics of them, but I think overall, especially in the United States, it's definitely lacking for sure, and I think that makes it very difficult.
Yeah, some of the high-risk groups like homeless, homeless, veterans, homeless, they have like enveloped social services, and they'll do some like pro bono stuff, but really it's ultimately like state funded, so nothing's really pro bono. It's difficult to get that type of resource. I mean, it depends. It depends, but it can be hard.
It's really difficult for people first to find providers because insurance is also really difficult for lay people to navigate.
Yeah.
I mean, even when I was getting my own insurance recently, I was like, okay, what does it cover? What does it not cover? And I don't have a primary care provider, so I would have to reach out to those people individually, see if they accept my insurance, and it takes time for that whole process. And then particularly for example, immigrant groups who may not speak the same language, they might have even more difficulty. Or if somebody is already struggling with their mental health, they might struggle to reach out even if they feel like they need help because of the stigma surrounding mental health. So I think it's just a lot, there are a lot of layers to the issue of getting help, I'd say.
Yeah, definitely, for sure. Like, there's definitely a lot of things that could be fixed and could be changed. I know that we're, students, and we're, I want to also mention that sometimes your college or your institution does have free services for therapy. I know that the UC school system has CAPES, which is like they provide, I'm not sure how many, but they do provide counseling services, and I know the Cal States also do the same. So maybe check in with your institute and see if they have any free programs or anything like that. For sure, I think that's nice that some schools do that.
Yeah. For me, I don't want to say that it's a access problem. I think for me, it is a stigmatized issue. So, for example, I would not seek professional care because I think it's personal and it's stigmatized. Like, I don't want to air out. This is not like the proper term to use, but I don't want to air out my dirty laundry. That's kind of how I see it, that I don't want to share all the things that are going on with me with someone that I don't know super well. Yeah, like you can get to know your therapist, but for me, I think it's hard. It's hard to overcome that like professionalism barrier because I feel like I lose professionalism if, especially in the role that we want to go into, I lose professionalism if I talk about it in that way. But it doesn't mean that I won't talk about it with my friends. I want it to be like almost like low risk to me because I feel like it does carry a risk. If you do medicalize it, if you do say, I go to therapy,
Yeah, I think that's a really critical point, honestly. Like you were saying, for you guys who want to be
It's the
physicians,
same with police officers,
but yeah, because
And
even
pilots.
pilots,
Sorry,
yes.
really?
Yeah.
Oh wow.
Yeah.
I mean, yeah, people who are in the military also, other therapists, if you were a therapist and you want to seek therapy, then I think people might look at you like, oh, like something's wrong with you. Why are you trying to treat other people?
Yeah.
And so I think that just goes to add on to why the stigma of mental health is so negatively impactful.
But it's funny because it makes sense. If you're a therapist and you're going to see a therapist, I'm imagining that conversation, I'm characterizing it. It's probably you're talking about some of the messed up stuff that you've heard people say, like anonymously, you're not sharing, but and also your own problems, like perhaps even what got you interested into that. Like I'm thinking, but it makes sense. Same thing for doctors. You see a lot of messed up stuff. It makes sense that you want an outlet and not to burden your family with that. It's just a different way to do it.
Yeah, I mean, people go to therapy to just better themselves, to talk to somebody in a productive way who they know has the professional training to be able to help them. And so it makes sense that, people should see it that way, but that's not always how it is seen in reality. So
Honestly, I do value and I see your perspectives. I'm sure a lot of the viewers who are watching this have the same perspective and agree with that. I just wish it was different. I wish the situation was, in a way where it's okay to get therapy. Like, for example, like, we don't know, like maybe the physician's going through like a divorce. Maybe it's a totally different reason and they need help to try to like balance their work and life. So I just wish there was like definitely less stigma around it so others could feel comfortable. And you know, institutionally I think a lot of changes need to happen in order for that to feel better.
I think some of the younger generations like us, it's going to become, I think there's always going to be an issue with the professionalism. I think that's going to be a prevalent problem because nobody wants to lose their job or, you know, whatever. But we're going to be able to talk to our peers, our age, our same age, and maybe a little older, a little younger. And hopefully it just gets more open and destigmatized. Stigma, you know, I think is not just institutional, but it's interpersonal. And I think that barrier to talking about it and getting the conversations that we need to move on and deal, I think could be easier.
Yeah, definitely.
Well, I'm really grateful that our conversation about mental health, just in general in society, has moved to be a lot more productive, that we are really valuing mental health now more than ever. So thank you for joining us today on Sedaye Daneshjoo, and we'll see you next time.